The Gauteng Health Department says they're investigating allegations of negligence and poor patient care at Helen Joseph Hospital in Johannesburg. Now, former broadcaster Tom London, who was admitted to that institution, made the claims in a video widely circulated on social media. He says many patients there have been neglected, with those needing treatment saddled with rude behaviour from staff, including doctors. In case you missed that particular clip, take a look.
The doctors that run around here, they treat the patients like cockroaches. No doctor, I haven't seen one doctor walk up to a patient in our ward and go, "Good morning, Mr. So-and-so, how are you?" Nothing. They treat the patients with absolute disdain and disrespect. I'm talking about this from the young Wits medical students all the way up the chain at this hospital. I've never seen a level of disrespect for human beings like this in my life. Yesterday I was taken down for a CT scan to check if I've got cancer. I had the CT scan, I was brought back up. A few hours later they came back, said, "Oh, we made a mistake, we forgot to put the dye in you." So I went down and had another CT scan. Now, I've been dealing with my doctors, Dr. Pillay and Dr. Van Eck. Every day they come and report back to me, they tell me what they're doing. Yesterday, a blonde doctor, some young blonde white doctor, she comes to my bed, looks at me, ignores me, starts writing in my file for 10 minutes, says absolutely nothing, and then announces that Dr. Pillay is no longer my doctor, I've got a new doctor. I asked why, and she said that he has handed his patients over to less complicated patients over to someone else. And she gave me the doctor's name, I can't remember.
Right, so that video goes on, of course, but that's just really the gist of what was said. He goes on there to show you the state of part of where he's sleeping and the surrounding facilities. Let's make sense of it with the DA's Jack Bloom, who joins us now via our video link. He, of course, has been tracking Gauteng Health literally for years. Jack, it's great to have you on the SABC. Thanks, as always, for making time to speak to us. Of course, none of this is new fundamentally, and I suppose that's actually what's disheartening here. The fact that despite the many reports, the times at which people have sounded the alarm, very little seems to be changing in Gauteng Health.
Well, absolutely. You know, every once in a while there's a social media video or a photo that goes viral. In one instance, there was a poor man dying of COVID at SABC Hospital, and he tweeted his condition, and the minister saw it, and suddenly there was an investigation. I think that this shows something fundamentally wrong in the Gauteng Health Department. Their complaints mechanism is not working. The only way people get attention is to go on social media, and you need to address the root cause. The root cause in the Gauteng Health Department is poor top management all the way down. I don't want to disparage the entire Gauteng Health Department and many fine doctors and nurses who do their best under terrible circumstances. But unfortunately, to what Mr. London has highlighted at Helen Joseph Hospital is not uncommon. It happens far too often, and you shouldn't have to go viral on social media to get some action to fix it. This hospital, Helen Joseph Hospital, has been notorious for many years. The casualty department is usually very overcrowded, and they haven't had a permanent CEO for many years. The present acting CEO is also the permanent CEO of the Rahima Musa Hospital. Now, how do you expect him to handle two hospitals at the same time? It just shows you something fundamentally rotten at the Gauteng Health Department, and things won't get better until you treat the root cause of this.
Yeah, you know, there's a part in that video where Mr. London shows us, you know, the sight of a fellow patient who sadly seems to have succumbed to their illness. And he mentions in that clip that that patient has been unattended, even though he took his last breath about 20 minutes prior to him taking that video. The point I'm making is the absolute indignity of it all is really hard to digest. I mean, this is a site where people are meant to get better. And it seems actually, in many instances, people actually just leave feeling worse if they leave at all.
Well, I think this is where you have to look at the psychological aspect of wellness. The Gauteng Health Department's claim they've got a campaign called I Serve with a Smile. Now, we would love to have that, but obviously it's not working at the Helen Joseph Hospital. And the stories that Mr. London tells of doctors talking very loudly about their latest bonus and the best restaurant to visit while a man is absolutely screaming in pain. I mean, that needs to be addressed very fundamentally. And I hope that that aspect of staff attitudes is corrected as soon as possible at this hospital and other hospitals. But it's even worse than that, the indignity. When I spoke to Mr. London, I visited him at a private hospital. You know, they raised funds and he was able to be transferred to another hospital. He said to me that the ward was filthy. You know, the first aspect of a hospital should be cleanliness, but it was full of flies, and there was flies all over the place. And when this poor man died and the body was left there for a number of hours before they removed it, you can just imagine the effect on other patients, and having a man drawing his last breaths and then dying and not being removed. But these flies were all over the place, and he said that's what actually prompted him to do the video, because the flies were gathering around the dead man. They were flying all over the ward. I mean, it's just horrific. A hospital experience should not be a nightmare. You should need to go in and both your physical and psychological aspects and well-being and decent facilities, you know, broken toilets. We've had broken toilets at the Helen Joseph Hospital for years. We've had promises that they'll fix it for years. It's about time something actually happened, and it starts with getting a decent, capable CEO of the hospital with a proper budget, and just cut out all the corruption and theft that goes in that department. That's why I say the problem starts at the very top. Premier Panyaza Lesufi a few months ago appointed a new head of department. You would think you would get someone with proven record and, you know, completely untainted by corruption. But in fact, the individual concerned is being investigated by the SIU for allegedly sharing an 8 million rand bribe with two other officials. Now, is that the type of person you appoint to be the top person of the Gauteng, person of the Gauteng Health Department? You know, I've said it before in the Gauteng legislature, the crooks are still in charge. That's what I said. And if Babita Deokaran, who, as you know, was murdered because she was trying to expose the corruption, if there was another Babita Deokaran in this department, she would be silenced all over again. So if that's the fundamental problem in the hospital, we're going to continue to have terrible stories like Mr. London, and nothing's going to fundamentally change, not at Helen Joseph Hospital and not at other hospitals as well.
Yeah, you know, in London's case, you know, luckily you say he's managed to raise funds and it's been moved to a private institution. I think his social capital is part of the reason why that video went viral. But the point really I'm trying to make is that not everybody is as lucky. One wonders how many other Tom Londons there must be who just never go noticed.
Well, absolutely. He had the social media skills and the gumption, I have to say, because, you know, I get a lot of calls from people at hospitals and they're scared, you know, because they say, well, you know, if we complain, then, you know, literally their lives in the hands of medical staff, and they're actually scared to complain. So I do my best with complaints. I deal directly with hospital CEOs, and seems to assist in many cases. Maybe that's because, you know, it's come to me as a member of the legislature, but I do wonder, like you do, how many others out there just suffer in silence because they don't have any way to draw attention to the outside world, and terrible things happen. Yeah. You know, Mr. London, of course, his cell phone was nearly stolen. In fact, it was stolen. He was able to recover it. If he hadn't got his cell phone back, we would know nothing about this.
Right. You know, you mentioned the fact that, of course, Gauteng Health has responded. They spoke about I Serve with a Smile campaign. And I'll give it to Mutalitali Modiba, who's been in a number of interviews. He is not really pushing back against what's there. In fact, he mentions that they concede to a lot of infrastructure problems and, you know, are aware of the attitudes of some staff. And I suppose my question becomes how then the department can make sure that the people who are trying to do their best, who are good at the jobs, aren't really overburdened by what's taking place, because let's face it, no matter how great your intentions, the human spirit sometimes is really affected by the environment that you're in. And if it feels like you're swimming against the current on your own, sooner than later, you also call it.
Well, yes, I think that, I'm sorry to say, the callousness of many staff, and I don't want to tar everybody. I really, there are angels in some of our public hospitals. Absolutely. And they do their very best. And you see this in the reactions to his videos. I mean, overwhelmingly people agree with him, but a fair number of people say no, they received they received good treatment, the staff were friendly, and we must recognize the good people, and we must promote them and expand that spirit. But many hospital staff are just burnt out. There's so many vacancies, equipment's continually failing. The Helen Joseph Hospital is frankly not a safe building. It's many infrastructure problems that they claim to be addressing now, but I mean, this has gone on for many years. Do you know that not a single Gauteng public hospital conforms with occupational health and safety legislation?
Wow.
How can that be? That's actually, they admit to it at health committee meetings that I've been at. So if that's the situation, you've got all these staff vacancies, things go very wrong in that situation. But here's a hospital that hasn't had a permanent CEO for a number of years. And that's where it all starts. You need an active CEO who improves morale, fights for his staff, makes sure that there's equipment. But let's just go back to Tembisa Hospital, where Babita Deokaran exposed so many of the problems there. The SIU has found that up to 3 billion rand was misspent or missing or wasted. 3 billion rand over 3 years at a single hospital. And I can tell you, it's not just Tembisa Hospital, it's other hospitals as well. Imagine if all that money that was just simply stolen actually was ploughed back into providing decent treatment at Tembisa Hospital or Helen Joseph Hospital. So that's why I say the problem starts at the top. I think that Premier Lesufi needs to get a new head of department. I've already referred what I think were irregularities in the appointment of the present head of department to the Public Service Commission. They are investigating. In the legislature last week, I asked for a copy of his qualifications because there's dispute over that. And the MEC for Health said to me, oh no, it's handled by the Premier's department. You'll have to ask them. You're trying to tell me that you don't have a copy of your senior person at the department. You don't have a copy of his qualifications. Yeah. What is there to hide? If you can't get your top management right, nothing else is going to get fixed in our Gauteng health system, unfortunately, and patients are going to continue to suffer.
Sure. One has to wonder what it will take for something to finally turn around. Jack Bloom, as always, appreciate your time. Jack Bloom, of course, is part of the DA in Gauteng.